Today we're going to go over the proper way to do a lunge. All too often I kind of see how my patients do their lunges, and we want to create some kind of stability and sturdiness within the body as we do it. So as I say, it's not always the exercise you do that is right or wrong, it's how we do it. So here we go, we're going to jump right into it. When it comes to a lunge, we have 1 foot forward, 1 foot back, as you hopefully know. Okay, I'm going to start with the front leg here. So when we go down into a lunge, we want to tax the back part of the leg. This is the hamstring and glute. We may get some low back, but you don't want to feel anything in the low back when you do a lunge. Okay, I'm going to do my very best here to show you my body without my arm getting in the way. But what we're going to do is when we come down, we want to make sure we're not collapsing over our hip flexors, okay? This is a big issue when it comes to lunges. But what happens is the pelvis starts to tip forward and our core lets go. And that puts us all into this quad. And that's where we start to get the issue. Because again, we're supposed to tax the hamstring. So what we want to do is, I like to start from the bottom, but we come down, okay? And I like to gently pull myself up and away from the front or from my hip flexors. Can you see the difference here? Tipping forward and then pulling up and away. That puts all of that tension into the back of the leg. From here, I initiate the lunge or the standing up. Once I feel like the hamstring has grabbed, I'll stand up through that hamstring. Okay? This makes a big difference in how we do it. It'll seem very difficult at first, but when you get used to it, it's a lot better for strength and functionality. Okay? I'm going to take this front leg, switch it to the back, show you what to do with that leg. From here, we want to be very mindful of what the foot is doing. If this foot has dropped, so if this foot has dropped here, you can see the tension or stretch that it causes in the back of the leg. But look what else it does. As this foot is up, as it falls, look at my pelvis, and then look at my left knee. Everything starts to fall apart there. And we don't exactly want that for this. So we want that nice and strong, okay? And that is kind of where it's going to stay. So as the front leg is doing about 70 to 80% of the work, this one is maintaining structure and helping just a little bit in the quad, okay? Front to back. We're here, coming down and back up. Again, front to back. If we're collapsed in, we want to push those knees outwards. And I like to imagine my feet are on a railroad track, and then I line up my knees directly over my feet. Again, you can see how it creates a good, sturdy, stable structure here. Okay? We want to be very mindful of where those knees are, as well as the hip. So if that hip is starting to drop, that means this side hip is not doing its job. So again, I'll set up from the bottom, okay? Make sure my hips are level. Initiate the lunge. Make sure this hamstring here has grabbed, and then stand on up. To an extent, this hip will drop, but the goal is to control it. If we've completely lost it or are unaware of that, then we've lost awareness of our body. And the goal is to progress, move forward, become self-aware, and learn. I hope you've enjoyed. If you have any questions, post them. Good luck. Enjoy the lunge.